I'm Carol Helwig. My day-to-day responsibilities are program oversight. We have 4 different syringe access sites, and one of the Boulder County Public Health sites we run in collaboration with Mental Health Partners, which is a 24-hour, 7 days a week facility. About 8 years ago, we started to see an increase in the number of people seeking out our services. We were consistently below 150 people per year up until about 2010. Last year, we served 1,739 people. So it was a very large increase over the years. Here in Colorado, they've researched that in people seeking methadone treatment. Over 70% of people seeking methadone had transitioned to heroin after prescription opioid. We provide syringes, sharps containers, and additional safety equipment to make every injection safe and reduce transmission of bloodborne pathogens, reduce the possibility of soft tissue infections. We also provide overdose prevention education in naloxone. We do HIV and hepatitis C testing and counseling and linkage to care. We also accompany people in their process of accessing mental health or substance use disorder treatment services. And it can be a challenge because there's limited services. If people want to access medication-assisted treatment, we can, but when people require a different kind of treatment, or if it's someone who's addicted to methamphetamine, there is no medication-assisted treatment for substances other than opioids, so it's a bigger challenge. I know that in our community we are starting to see a little bit more of fentanyl. I think that it's a really challenging issue that there is so much stigma associated with people who use substances of any form, and especially people who inject substances. I've tried to frame it many different ways, and I think one way to potentially think about it is thinking about a person who is diabetic and who needs to inject insulin to be able to maintain their blood sugar levels, to not go into a coma or to suffer ill effects. People who are addicted to other substances, their body is physically dependent in the same way that a diabetic is dependent on insulin. Having someone stop cold turkey, yeah, it's going to be very person by person, but it can cause severe physical reactions up to death.